Hi, I'm Zach Thiesing. I'm a senior athletic training student at FGCU, and today we'll be conducting a Scat5 assessment. So the first step is going to be the immediate or on-field assessment. Step 1 is going to be red flags. That includes neck pain, tenderness, double vision, weakness or tingling in arms or legs, severe or increasing headache, seizure or convulsion, loss of consciousness, deteriorating conscious state, vomiting, or agitative or combativeness. The next step, we're going to do observable signs. This can either be witnessed or through a video. Some of the things we're going to notice is lying motionless on playing surface, any balance or gait difficulties, disorientation or confusion, blank or vacant look, or facial injury after head trauma. And those are going to be yes or no questions. Step 3 is going to be the memory assessment. This is going to involve the MATIC questions. The patient is going to answer with the best effort that they can. These are all going to be yes or no questions. So the first ones are, what venue are we at? Which half is it now? Who scored last in the match? What team did you play last week or last game? And did you win the last game? Step 4 is going to be the examination of the Glasgow scale. This is going to involve eye response, verbal response, and motor response. This is going to include eye opening, response to pain, speech, or spontaneously. Verbal will include no verbal response, incomprehensible sounds, inappropriate words, confused or oriented. Motor will be no motor response, extension to pain, abnormal flexion to pain, flexion withdrawal to pain, localized to pain, and obeys command. You're going to add up all the scores after this and then determine what's best. Cervical spine assessment is next. You're going to check if they have any neck pain. If they don't, you can check all their active range of motion within the neck and also test myotones or dermatomes. Okay, now we move on to the office or off-field assessment. Step 1 is going to be information about the athlete and their background. So you're going to ask them about their sport, team, and school, time and date of the injury, years of education, age, gender, their dominant side, if they've had any concussions, when was the most recent, and how long their recovery was. They will also answer if they were hospitalized for a head injury, diagnosed or treated for any head injuries, or learning disabilities, and other conditions. The second step will be the symptom evaluation. This is when you will hand over the paper to the patient, and they will answer all the signs and symptoms that they have. There's a list of 22, ranking from 0 to 6. The patient will give their feedback on which ones they have. Step 3, the cognitive screening. This is going to involve multiple different sections where you score points. So the first one's going to be orientation. I'm going to ask the patient a series of questions, and they're going to score 1 point for every correct answer. So what month is it?
May.
Okay, what is the date today?
May 31st.
What is the day of the week?
Friday.
What year is it?
2019.
And what time is it right now?
1:35.
Okay, so they got 5 points for that one. Next is going to be their immediate memory. I'm going to test them for their memory. I will read a list of words, and when I'm done, they're going to repeat back the words in any order as they can remember. We're going to do it 3 times, and I'm going to repeat the same list to them. So, let's start with jacket, arrow, pepper, cotton, movie.
Jacket, pepper, cotton, arrow, movie.
Okay. Jacket, arrow, pepper, cotton, movie.
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 On the concentration portion, we're going to do digits backwards. So I'm going to read a string of numbers, and when I'm done, the patient's going to repeat back to me the numbers in reverse order. So for example, if I read them 719, they will respond with 917. 526.
625.
1795.
9517.
Okay. 48527.
48527. 48527. 875 48 527 854.
831964.
831. Wait, repeat that one.
831964.
6358.
Okay. The next section is going to be months in reverse order. So if you can tell me the months in reverse order.
December, November, October. Wait, December, November, October, October. Yeah, I can do that.
Now we move on to step 4, the neurological screen. We're going to go through a series of questions and details for the patient, and they're going to either be yes or no responses. So the first one is going to be, can the patient read aloud and follow instructions without difficulty? So I'm going to ask for the patient to read some of the signs on the symptom chart. Read your first 3
Headache,
symptoms.
pressure, and head, neck pain.
So that's a yes. Does the patient have full range of free passive motion, pain-free passive cervical spine movement? So I'm gonna ask if I can palpate your head for you. All right, and now can I take your head to extension, flexion? Any pain?
No.
Okay. Next is going to be, without the patient moving their head and neck, can the patient look side to side, up and down without double vision? So I'm just going to take a pen and instruct the patient to follow with their eyes. Alright, let me pass that. Can the patient perform the finger-nose coordination test normally? So they're just going to extend their arm all the way out and bring their finger to their nose. Okay. And now the last one is, can the patient perform tandem gait normally? So they're going to stand up and they're going to walk with their heel to toe on a straight line and walk back. So can you stand up for me?
Yes.
And start here and just walk to the end of the chair and back. During this, you're going to be looking for any abnormalities, like if they step off the line, fall, separate their heels or toes, or if they grab an object nearby to catch their balance. Alright, and they did pretty well. The next is going to be the balance examination. So, we're going to figure out which is their dominant foot. Which foot? Right foot. Alright, and we're going to be testing on carpet. So the first one is going to be the double leg stance. So we're just going to stand. The first stance is standing with your feet together with your hands on your hips and your eyes closed. You should try to maintain stability in that position for 20 seconds. And I will be counting the number of times you try and move out of the position. Yeah. So if you can just stand with your hands on your hip for me, close your eyes, and they would stand here for 20 seconds, but for the purpose of this video, we're going to cut it short. The next one is going to be the single leg stance. So they said their right foot is their dominant. So the dominant leg is going to be held up while they balance on the non-dominant. They're going to do this again for 20 seconds with their eyes closed and hands on the hip. And you can start now. Again, I'll be counting for the number of times they fall out of the position, open their eyes, stumble, or try and grab for an object. The last one is going to be the tandem stance. This is where they'll stand with their non-dominant foot in the back, same heel to toe motion, and they'll balance there for 20 seconds again, and I will again count for any falls or disruptions. And you can stop. Alright. The next is going to be the delayed recall. So I'm going to ask if the patient can remember the list of words I mentioned earlier, and I'm going to give them a point for each one they can remember.
Cotton pepper movie jacket.
Okay, so you got 4. And the last step is going to be the decision making. Here is where you're going to enter in all of the scores they got from all the other steps. Here you can also determine whether they have a concussion or not, but scoring on Scat5 should not be used as a standalone method to diagnose a concussion. Measure recovery or make decisions about an athlete's readiness to return to competition after concussion. And yeah, that is Scat5.